Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob. We have some tremendous questions. We have a concerned son of an individual whose dad is 84 years old and has had quite a bit of heart issues. And I want you to know that we have practice members in our office that are over 90 years old with heart issues. And you have to understand, I have a Doctor of Natural Health degree and I also have a Doctor of Chiropractic degree. And we use diet and nutrition in our practice. I actually have a tool right next to me called an acoustic cardiogram that we use to assess heart sounds. Your heart makes noises, lub-dub. We can take that noise and translate it into a mechanical energy, and we can look for dietary and nutritional deficiencies. So we have an array of nutrients that we use in our practice to help support heart function. But the real key that we also learn is that the nerves from this upper back go right to the heart. And when they put defibrillators in someone and pacemakers in someone, etc., it's altering nervous system function. So in our practice, we focus on this area. So I don't know who you are or where you are, but you want to just find yourself a very skilled, knowledgeable, nutrition-based chiropractor. Make all the difference in the world. There's somebody that had some questions about being congested in their sinuses during pregnancy, and they taken a lot of different medications, etc. And here's what I have learned. People who have nasal congestion, it's always a food they're consuming. Number one, it's dairy. Number two, it's gluten. And number three, it's peanut butter. So you do not want to be eating donuts and pastries for sure. It happens all the time. I have consultations and conversations with people, and I always go back, we start looking at their diet. It's dairy, it's peanut butter, it is gluten. If you have those, anybody that's watching anywhere in the world right now, those three foods will cause you to have chronic sinus challenges. We had somebody that was concerned about their teeth, they're pregnant and dentists, and they wanted to know if they could get films. Well, you can obviously get films while you're pregnant. But we in our practice, we have a lead apron. We do not take films of very many pregnant ladies unless they're involved in some kind of trauma. But if you are at a dentist that is very innovative and very scientifically advanced, they should have a full body apron if you need to have your teeth tested with x-ray. Somebody was wanting to know about their immune system and how to build it up. Sleep is really important. Avoiding sugar is very important. But I'm going to go right back to it again. This upper spine area right here has a lot to do with immune system. We have practice members that have been in our practice since the late 1970s where they used to get pneumonia, don't get pneumonia anymore. They don't get the flu, they don't get colds, they don't get sick. Your nervous system controls the function of your body. Information goes from the brain cell to the tissue cell back up and forth. So regardless of your thought and opinion of spinal correction and chiropractic care, I'm going to tell you from my own experience, it really works, and it doesn't have all the bad effects of flu shots, etc. Okay, somebody wants to know if they take liquid iodine, will they lose weight? Not necessarily. The liquid iodine may in fact support thyroid function, but if you're eating too much and you're not moving, you're not going to lose weight. And I have individuals that are in my practice and they look at me and say, Dr. Bob, I just can't seem to lose weight. You know, I watch my diet every day and I would love to be eating certain items on a regular basis and I choose not to. I rode my bike this morning. I'm going to take a walk this afternoon or early evening. So I want you to know I actively engage in regular activity to burn calories, and I am totally aware of what I'm putting in my body. Stay away from those liquid calories because those can really torpedo the best of well-meaning diets. Individual wants to know about diverticulitis. She said it came on just like that. She had her ovaries removed 5 years ago. She has a tilted uterus. Anytime that somebody has diverticulitis, which is inflammation of the gut, I look at dairy and gluten. Dairy and gluten. Also, possible parasites. Do you grind your teeth at night? People that grind their teeth at night, it's usually a sign of parasite involvement. Do you eat sushi? Do you eat wild game? Those are just some thoughts. But if you've had some surgical challenges going on, your body, regardless, it's been traumatized. Back off dairy and peanut butter and gluten. Last question. What do I do if my 3-year-old daughter gets croup? I'm going to tell you right now, Get that 3-year-old off of dairy, sugar, peanut butter. Dairy, sugar, peanut butter, and gluten. Because see, the bottom line is those 3 foods are common causers for health problems. We finished doing some corporate work locally. We had some individuals that we did a pilot program on. All of them had a really poor diet about 2 months ago. They made dietary changes. I just did the evaluation yesterday. Inflammation goes away. So croup, chronic cold, sinus problem, dairy, wheat, peanut butter, drink water, stay away from sugar. Wonderful episode. I'm Dr. Bob DeMaria, the Drugless Doctor.